Hi, you came to the emergency department because you were short of breath. You've been coughing with phlegm, and I've also been noticing some chest discomfort. You may or may not be having fevers, chills, or night sweats, but you've been feeling pretty badly. So you decide to come into the ER, and the ER physician diagnoses you as having a COPD exacerbation and that you must be admitted. Hi, I'm Dr. Naznin Jamal. I'm board certified in internal medicine, and I practice as a hospitalist. My goal is to provide my patients with education for common diseases requiring hospital admission. So let's talk about COPD today. What is COPD? COPD stands for chronic obstructive pulmonary disease. It means that lungs have a difficult time in air exchange. Each time you inhale, you are breathing air in an attempt to absorb the oxygen from it. And each time you exhale, your lungs release the carbon dioxide buildup from cellular waste. But in COPD, the lungs aren't able to retain the normal elasticity of breathing in and breathing out, thereby making effective ventilation difficult. This means that there may be some dead space in your lungs. You may have to exhale a certain way, such as with pursed lips. You may not be picking up as much oxygen from regular air. You may become short of breath while performing mild tasks such as household chores, or have had to find out that you can no longer perform the higher intensity chores such as vacuuming and mowing the lawn. You probably had to let go more intensive tasks such as exercising due to the shortness of breath associated with completing them and often have to rely on caregivers. Other symptoms include the following: frequent coughing with or without sputum, wheezing, which is a musical quality to your breathing, noisy breathing, tightness in the chest, which is often confused for being heart-related, tiredness, fatigue, frequent infections of the lungs. You keep getting diagnosed with pneumonia by your PCP and you keep getting antibiotics, a change in appetite, you're not as hungry, and then finally weight loss. You haven't been intending to lose weight, you're eating the same, but you find that you are losing weight. So what happens during a hospitalization for COPD exacerbation? During the COPD exacerbation, the patient often has symptoms of shortness of breath that have worsened. They're coughing a whole lot more with sputum or phlegm, and they're very fatigued. They can't even get up from the bed to go to the bathroom. They may have chest tightness or discomfort, and they may or may not have fevers, chills, night sweats, or body aches. There are additional symptoms not mentioned here. What causes an exacerbation? Well, it can be anything from being infected with a respiratory virus or a bacteria causing a pneumonia. There could be a blood clot known as pulmonary embolism or other unidentified stimulant. Once you're admitted, you will have basic blood tests, which include a CBC, a complete blood count, BMP, a basic metabolic profile. Additional tests may include a viral panel to detect a particular virus, blood cultures if your physician feels you're infected, and procalcitonin, which often aids the doctor in determining your overall clinical picture. A chest x-ray will also be taken to assist the physician determining if there's any other findings to suggest an alternate diagnosis, not COPD. But often, the chest x-rays in patients with COPD exacerbations are usually normal. You may or may not be seen by a pulmonologist during your hospital admission. Treatment includes inhalers and steroids. You will be given an inhaler that assists the muscles of your bronchioles, which are the muscles of the airways of your lungs, to relax and allow improved inhalation. You may be provided by an inhaler with two medication components. One is an inhaled steroid, such as budesonide or fluticasone, and the second is a longer-acting inhaler that allows your muscles of your airways to fully relax, such as salmeterol or formoterol. Now, if you're requiring hospitalization for your COPD, you may likely be started on IV corticosteroids. These steroids assist with the pulmonary inflammation, allowing your body to speed up recovery from the COPD exacerbation. And then finally, additional treatments may likely require oxygen if your oxygen saturation or levels in your body are low. If you have COPD already, your threshold for low oxygen levels is a saturation of less than 88%. For everyone else, it's 90%. The oxygen amount will be determined by your physician and the ancillary support staff. Attempts will be made to try to wean you to the lowest oxygen setting needed to maintain your oxygen to normal levels. These oxygen thresholds are different for different people and also different for other lung diseases, not including COPD. And then finally, let's talk about smoking. If you smoke, you need to quit. The most common cause of COPD development is smoking. So fully expect your doctor to give you counseling on smoking cessation. They will ask you how much you smoke, how long you've smoked. You may even be asked about alternate nicotine products such as vaping, cigar use, and the use of chewing tobacco. Now, as your symptoms improve, your physician and medical team will discuss discharge. As always, please ask your hospice questions regarding your medical care and treatment plan. Thank you.